الله لا إله إلا هو له الأسماء الحسنى.
بسم الله الرحمن الرحيم. شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان ومن شهد منكم الشهر فليصم ومن كان مريضا أو على سفر فعدة من أيام أخرى. يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون. صدق الله العظيم. My dear respected elders, brothers and sisters who are listening to my speech, Assalamu alaikum wa rahmatullahi wa barakatuh. Today, Dr. Amir Saab has come from his surgery and he has given us time. We are honored by his presence. Jazakallah khair to Dr. Amir Saab. Every year, he takes some precious time out and gives some time to explain to us how we can go through Ramadan al-Mubarak in a healthy way. So remember that even if you look at the teaching of Rasulullah sallallahu alaihi wasallam, Rasulullah sallallahu alaihi wasallam teaches us how to fast. You know, Rasulullah sallallahu alaihi wasallam says that in suhoor is barakah, is blessing. Even though if you do not want to eat anything, have a bit. And if you look at the teaching of Rasulullah sallallahu alaihi wasallam, Rasulullah sallallahu alaihi wasallam used to have a few days in odd number, 3 days, 1 day, whatever day was available at that time. He used to take it nice and light and a few days. And Dr. Sawad explained, but with 1 day you can go throughout the day without eating anything. So all these teaching is about Rasulullah sallallahu alaihi wasallam. This is what Rasulullah sallallahu alaihi wasallam taught us, that fast, but fast in a healthy way, in a healthy manner. And another hadith Rasulullah sallallahu alaihi wasallam says, "Al-mu'minu qawiyyun khayrun min al-mu'mini da'if." A mu'min, a believer who's strong, is better than a believer who's weak. So all the teaching of Rasulullah sallallahu alaihi wasallam is teaching us that fasting is compulsory. For pity reason, pity excuse, we're not allowed to not fast. But when we fast, we should make sure we fast in a healthy way, in a healthy manner. So now I'll give it to Dr. Sam. He'll carry on, inshallah.
Jazakallah Mufti Saab. It's always a pleasure coming to your mosque and talking to people. It brings me closer to the community as well. And we've come here year after year with mostly the same reminders. Just like we need reminders for religious purposes, same as we need reminders for health purposes as well. We are approaching Ramadan, inshallah, starting hopefully in next few days. I was reading somewhere, हर गुजरता हुआ लम्हा हमें पकोड़ों के करीब लेके जा रहा है. So the reason I am here is to not to take away from the pakoras, but give you some advice around the health benefits of fasting, how you can fast safely in Ramadan if you have got an underlying disease. And there's some common problems we all encounter because of upset routines in Ramadan, how we can tackle them. So my name is Dr. Amir. I am a GP in St. David Court Surgery. I'm also got some specialist in diabetes as well. So human body needs food to work. The energy comes from the food we eat. A normal requirement for the food we eat is measured in calories. So a caloric requirement of an adult depends on how active you are, can vary from 1800 to 3000 calories. If you're very active doing hard labor work, your calorie requirement is about 3000 calories. If you're a woman not doing much activity, just at home, then your calorie requirement is lower, so 1800 calories. And a fluid requirement, the fluids we drink include all the tea, coffee, water, is about 2 to 3 liters. Again, that depends on how active you are. If you're exercising, your fluid requirement is high, but at least 2 to 3 liters of fluid is required for your body to function. Approximately, we'll be fasting for 13 to 14 hours, inshallah. and we've only got 11 to 12 hours of eating and sleeping as well. So if you take out 7 to 8 hours of sleeping, then you're most of the, you're left with 4 5 hours where you're actually eating. So we need to be very careful on what we eat and how we eat, because your body doesn't require all those 3000 calorie at one time. You have to spread them throughout the day, but in fasting we've got only few hours to spread them out. So it's important we follow some good routines or eating habits to benefit our body from it. So where we've got religious benefits of fasting, spiritual benefits, it brings us very close to Allah. Allah has provided some medical benefits as well in fasting, alhamdulillah, and it's like a bonus for us. If we want to take the benefit, we have to follow some good habits through the fasting month. One of the biggest benefit we can achieve is weight loss. Our community suffers obesity, which is weight gain, being overweight because of the lifestyle we are living. We are a community which are heavily dependent on carbohydrates like rice and rotis, and these are the two foods that would put your weight up. And we also use a lot of oil and ghee in our cooking, and this is also uh, uh, you know uh, causing the weight gain for us. So to benefit from the weight loss, it's important to understand how fasting will help us. When you're fasting, your fat in the body, जिसे हम कहते हैं चर्बी is going to be melted. चर्बी पिघलना शुरू हो जाएगी, क्योंकि आपके जिस्म में खाना नहीं है. जब आप खाना नहीं खाएंगे तो चर्बी पिघलेगी, and when this fat starts to burn out, it provides energy to the body. It's like a resource for the body, that in case when you're not eating, all your fat is going to produce energy. So it's an ideal time when you're fasting, your fat is burning out, producing energy. So all the extra fat you can burn while you're fasting. But what we do is we overeat in iftar, and then all the benefit that we've achieved in last 12 hours is gone. So but we, to sustain that benefit, it's important that we don't overeat. We only eat what's required for our stomach. Another benefit is we control our blood pressure, it lowers the cholesterol. Unfortunately, the foods we consume in iftar are quite heavy in cholesterol and fat. So again, whatever the benefit we've achieved goes in the air basically. So, but if you do it properly, you can control your blood pressure and your cholesterol as well during fasting. Mental well-being, because it's about self-control, it provides you sakina. So you're mentally, you will be less depressed, less anxious when you're fasting. You'll not, you'll not be angry. You'll try to control yourself, because religiously it's not allowed. So it gives you that self-control, and your mental well-being is much better in Ramadan compared to other months. There's some new research. We all talk about dementia या भूलने की बीमारी जो हमारे एल्डरली लोगों में हो जाती है. एक नई रिसर्च के मुताबिक रोज़ा रखने से या फास्टिंग करने से, जैसे हम आजकल जो इंटरमिटेंट फास्टिंग का डाइटिंग में प्लान चल रहा है, उससे बहुत एक रिसर्च आई है जिसमें हमारे ब्रेन से कुछ ऐसे केमिकल्स रिलीज होते हैं जिससे डिमेंशिया जैसी बीमारी नहीं होती, या प्रिवेंट होती है, या उसको हम दूर तक प्रिवेंट कर सकते हैं. तो it's got new research that shows that chemical release from our brain can prevent dementia if you're fasting. But again, to benefit from it, if you do it continuously, because for example, people fast Mondays and Thursdays through the year as well, so that has got some benefit in intermittent fasting. So again, a benefit that alhamdulillah, from religious point of view we get it, but again in health as well. We already mentioned about self-control. It's an ideal month if you've got some poor habits like smoking, you can stop. If you're fasting and you've stopped smoking for 12 hours, you can probably do it longer as well. So that's the willpower you've got. but you have to try. If you don't try, you won't be able to achieve it. There is help available through Stop Smoking Wales. You can contact them and they will give you advice as well. You can get some alternates like nicotine patches and nicotine chewing gums, which can be benefit if you want to stop fasting through the Ramadan. Then get some help from Stop Smoking Wales. Because of our poor habits of eating in Ramadan, we develop some problems through the Ramadan because of unhealthy eating behaviors. Um, One of the problems we see is we miss out suhoor because we can't wake up early in the morning. And that leaves us a big gap of 18 hours or so without eating. As I said, your body needs energy. If you've got no energy for the body to function, you will feel unwell with it. You will have a lot of symptoms through the day, which will make you feel weak. So it's very important not to miss sahur. Even if you get up and have a small meal like a cereal or something, it will take you through the day. As Mufti Sahab mentioned, dates or khajur have got a lot of energy in them. If you have few dates in the sehri, that will take you through the day, inshallah.
How many calories is the one date?
So it depends on the size of the date as well. So normally if you're having 2 or 3 dates, not more than 100 calories. Yeah, depends on the size. If you are having big medjool dates, they are more.
How many calories do we need to survive?
So for the whole 24 hours, you probably need about say 18 to 2000 calories to function. Survival, you can do it even with few hundred calories.
Yeah.
So survival is a different thing, but to function properly, then you need that kind of calories. 2000, about on average 2000 calories. But like if you look at the big medjool dates, they've got 80 odd calories in big dates, so they are quite caloric. If you know, but like small ajwa dates have got less. But I'll come to that in a minute as well. The dates are good resource because they are, in medical terms we call them low glycemic index food. That means that when you eat a date, it doesn't actually just go into your body straight away, it goes slowly. So it's providing the energy all through the day, not in one go. If you like eat a Mars bar or a chocolate, it will just go in 20 minutes all into your bloodstream. But a date will stay longer in your body, providing energy. So rest is again very important. We don't sleep well through the Ramadan. We need to make sure we have that 7-8 hours of sleep. If we are not sleeping well, we'll have a headache, we'll wake up very tired, and this will cause more medical problems later on as well and affect your mental well-being. Some common problems that we encounter: indigestion, heartburn, commonly known as गैस की प्रॉब्लम हो जाती है या पेट में तेजाबियत है, डकारें आती हैं. This is all because of the wrong foods we eat, and your stomach is empty for longer hours after that. So best thing is to avoid certain foods which cause this problem: spicy food, uh, oily food, fizzy drinks. All these kind of food will cause the problem. Try and avoid them as possible. It's okay to have 1 or 2 pakoras. I don't want to stop you from eating pakora, but in a very moderate or controlled quantity. What will help? You don't need to really go and see your GP for it. You can go to a pharmacy, tell them you've got this problem. They'll give you some Gaviscon or Rennies or omeprazole or omeprazole. It's also available in supermarkets like Home Bargains. You can actually buy omeprazole over the counter. It's not an expensive medication. So you don't need to wait 2-3 weeks to see a GP for this problem. You can actually treat it yourself. If the problem still persists and you've tried to take the remedies which I mentioned, then you should see your doctor. But most importantly, prevent it by eating the right food. Headache is another common problem. In the first few rosas, everybody will get a headache, and that's because of lack of fluid intake, disturbed sleep. So the fluid I mentioned, 2 to 3 liters, is very important. You cannot drink 1 liter of fluid in Sehri and 1 liter in Iftar, because your stomach cannot hold the food and fluid together for that long. And if you do so, you will get the heartburn, as I mentioned. So the Best thing to do is split your fluid intake in those 6-8 hours when you're not fasting and not sleeping. So you're trying to drink a little bit with aftar, little bit at sehri, but in between, for example, you go to tarawih, take a bottle with you, keep sipping about half a liter through the tarawih, go home, have a glass of water before you go to bed. It's important. If you drink a lot in sehri, you will be going to the toilet back and forth, and it will come out straight away and not benefit you. So try and split your drinking habit through the non-fasting hours. If you do get a headache, take some paracetamol at the sehri or aftar time. It's okay. It won't cause any trouble through the day for you. So if you have a headache at sehri time, just take 2 paracetamol, or at aftar, take 2 paracetamol. Avoid any heavy exercise, because again, exercise will make you dehydrated, and that will cause more fluid loss from your body. And if you're not drinking already, then you'll get a headache because of that. And I mentioned about sahur meal as well. It's very important that we eat in sahri. Dehydration, I've already mentioned. Make sure you're drinking plenty of fluids, and avoid any heavy duty exercise. It's okay to go for a walk, but if you're fasting, it's better to exercise towards the end of the day rather than early in the day. So near time aftar, maybe an hour or before aftar, go for a walk or do some light exercise. Not in the day when you're more at risk of dehydration. Constipation, or in Urdu we call it kabz, is a very common problem we encounter, and again, the reason is wrong foods and also the lack of fluid intake. So it's important we get some fiber in our diet. Fruits are good source of fiber, salads are good source of fiber, cereals like Weetabix is good source of fiber. Again, fluid is very important to make sure you drink through the day to avoid constipation. If you do get it, it's a common problem, we all come across it. You can just go to a pharmacy, buy some laxatives, and it will help you to relieve the constipation. Sometimes you don't even need to go to pharmacies. Supermarkets also keep it on the shelf. So just take some laxative. If the problem persists and you've tried this medication, go and see your doctor. So healthy diet, we've already touched on that. We need to balance our diet. The foods to avoid is high sugar foods, high cholesterol, high fatty, fried food. We need to avoid that. Fizzy drinks is also will cause a lot of acid in your stomach. Try and avoid it. It's better to eat things like rice in the morning if you in sehri time, because rice will give you energy through the day. Dates are good, couscous is good, pasta is good. So these all foods will give you energy throughout the day. Mentioned, try and eat more milk based food, because it reduce the acid in your stomach and neutralize the gas, and hopefully you'll not have the indigestion and heartburn that you would normally get with spicy food. People who have got high blood pressure are on medication. If the blood pressure is well controlled, you can fast. Make sure you take your medications at aftar time, not in sehri time. Otherwise, it might give you a low blood pressure and a headache through the day. So it's better to take it at aftar time. If your blood pressure is not controlled, go and see your doctor or your practice nurse, because your medication may need to be adjusted to fast safely in Ramadan, because high blood pressure is cause of heart attacks and strokes. In some countries, we have seen in Ramadan the risk of heart attack and strokes goes up, because we are not actually making sure the medication is adjusted according to the needs of the month. Diabetes, again, if you it's most of the cases in diabetes, it's okay to fast if you're on oral medication. If you're on certain medications like insulin, or there's an oral tablet called glycoside, it might put your sugar levels down. So it's important to seek advice, because your medications may need dose adjustment. So see your GP or the diabetes nurse in your practice, so they can make your insulin adjustment. If you're on oral tablets, better to take your morning dose in the evening and evening dose in the morning. So if you're on, so for example, metformin, which is a diabetes medication, it's better to take it in the evening and a smaller dose in the morning. And always, if you are on insulin, and glycoside, you should check your blood sugar levels. Nowadays, there's a new device that has come in. If you're on insulin, multiple injections in a day, you are eligible to get it on NHS. So it's a small device that goes on your arm and sticks on your under the arm, and it remains there for 14 days, continuously telling you about your blood sugars, and you can monitor it on your phone. It's called a Libra device. So you can speak to your nurse. If you are on insulin, you're eligible on it. If you're not on insulin, you don't need it at all. Again, most important thing, if you feel you cannot fast, don't do it, because it will harm yourself. Sometimes we see people who are very weak, have got lots of medical conditions, and they would want to fast because it's very close to everybody's heart, and then they collapse, they end up in hospital, have more complications because of their diseases. So it's important, if you don't feel well, don't fast. Allah has made that exception for you, so avail it. Asthma is another chronic condition. People are on inhalers. It's okay to fast in asthma if your asthma is well controlled. That means you're not having too many attacks of asthma. You can use your inhalers because most of the inhalers are either once a day or twice a day. You can use it in Sahri and Iftar time. In between, if you do get an asthma attack, you may need to break your fast and use your inhaler. I'm not sure what is the ruling from Islamic point of view. It breaks the fast, isn't it? So make sure that don't wait till iftar, because asthma attack is a life-threatening condition and you can die from it. So if you feel that you're struggling to breathe, use your inhaler, and later day you can fast for that. For the fasting day you've missed, you can fast later on. That's all from me. Thank you very much. Jazakallah for listening. I hope this will benefit you and you can take this to your families and friends as well.
الله لا إله إلا